Welcome to CareTalk Shorts, where we take one important healthcare issue and cover it in depth. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Well, John, let's talk about the kidneys today. Just how big of an issue is kidney disease in this country?
Kidney care could not be more important. We've got 37 million Americans who suffer from chronic kidney disease. 1% of all Medicare beneficiaries, 7% of all costs. We've got to be paying attention to this. And frankly, we're doing kind of a lousy job taking care of people.
John, it's not really new news, and yet the administration all of a sudden seems to be prioritizing it. What's going on?
Well, I think that it's possible that the actual personal experiences of either Secretary Azar or the president really have affected this, that the family members or relatives who've been affected by kidney care. But I think this represents something we've seen a lot of, which is with a lot of noise, that in the healthcare side, this administration is paying attention to some of the biggest issues that need to be addressed. And we've got a flawed structural system that compensates for the wrong kind of care in kidney disease, which is a devastating disease, and that other countries, frankly, do a much better job of.
Well, John, let's unpack that a little bit.
Sure.
What's flawed about the system here?
Well, we've got a system that has a couple of structural things that I think the executive order, which is what you're referring to by the White House, is meant to address. One, we have a system that prioritizes care in clinics as opposed to care in the home. Nearly 80% of all the care that people get, dialysis care, where you go to a center for end-stage kidney disease to have your machines effectively clean the toxins from your bloodstream. 80% in lousy clinics that are dreary to go to in this country versus 80% done at home with home dialysis, in some cases more safely and effectively in some Asian countries. Home dialysis is much more popular and much more prevalent in every other jurisdiction of the industrialized world. We've got a flawed system that incents for the wrong care in the wrong place for many people who are suffering from chronic kidney disease. So that's one, and I think that's really important. And there are a number of other aspects of this executive order that I think I'm optimistic about.
John, one of the things that we talk about here a little bit is on transplantation. Where, of course, dialysis isn't really the goal. It's more something that you do hoping to have a kidney transplant, and yet a lot of people die without being able to get that transplant, and I understand there's a lot of organs that are wasted. There's a lot of weirdness in the system.
Yeah, no, just stepping back a second, when you've got chronic kidney disease, what you want to do is first prevent someone from crashing into dialysis by taking care of them upstream. And part of the executive order is to spend more time and resources leveraging CMMI, which is an institution that, ironically, the White House tried to kill at one point, to come up with the innovations around caring for, and there's a lot of really interesting approaches to doing better chronic care management so fewer people need dialysis. Dialysis is that step when your kidneys fail, and that we're set up to do that in the wrong place, and I think with lousier outcomes. And finally, there's a challenge when dialysis ends where you need transplantation. And other countries do a better job at organ support and supply than we do. What do you think about that aspect of the requirement and the direction from the president?
John, it's always tough with organ donation because you want to make sure that it's not something where someone's being coerced into giving their organ. Kidney, unlike a lot of organs, you've got two of them. Most people, last I checked, most people have two to start with. So you can give one. But on the other hand,
I think coercion is really the worry that people are going to go body snatching.
Oh, you're so naive, John.
Body snatching. And this is really about a flawed system of incentives and structures.
Yeah, so fair enough, John. So you get into the wonky part of it, which you always give me a hard time about, but there's a bunch of locally based organ supply entities, and they get
organ procurement organizations.
That's right. They get graded based on how well they do in terms of preserving organs. But they can sort of decide what's in the numerator and the denominator. And long story short, a lot of organs are actually wasted. So organs that they actually do have that could be transplanted don't get transplanted. And then because they don't give the donors any kind of incentive or any really compensation for lost work time or travel time or so on, the number of people giving kidneys is really low.
It's a screwed up system. I don't think you did the best job explaining it.
Okay, John.
But if you look at it,
yeah,
Israel, when they changed the incentive structure around compensating people for providing that excess kidney to basically save a life, but just changing the incentives, they had a 4x increase in the number of kidneys that were donated. And there are definitely people dying today because they aren't getting access to a healthy organ. And I think the problem with the organ procurement organizations, which again I think the executive order is meant to fix, is that the as you said, the math around how they're measured, they get to set. And unfortunately, it's a system that's inefficient. And as many as 30,000 organs may be being wasted a year, which is terrifying when there's people on that waiting list for organs who are dying. So I think this is all to the good. Do you see anything dangerous or wrong in the executive order?
Not necessarily, John, except I guess when you see something like this sort of come up suddenly without having any discussion about it, it makes you think, like, why aren't we spending time on this? So instead of Trump and others attacking the Affordable Care Act and trying to tear it down, why don't you just work within the Affordable Care Act, which you point out, this is actually using the Center for Medicare and Medicaid Innovation, CMMI, part of the Affordable Care Act. Why aren't we working on these sort of problems? This is where we should be as a country, and working not through executive order, but working with the states, working with the Congress to make it happen. So,
but I don't know, David. I think on this one, I totally agree with you on the Affordable Care Act, and I totally agree with you that we should be improving the structure we've had as opposed to just oddly tearing apart politically and then leveraging it for something. But let's give the president, the secretary, and the head of CMMI credit for taking on a big, hard problem, ordering people to really start the process of reordering the incentives. They've actually done a bunch of work here, and I think these ideas are all good. I actually saw a lot of good here. I just think it's ironic that they're using the structure embedded in the bill, to your point, that they're tearing down. But I think this is just a wise move, and if and executed well, will improve a lot of people's lives.
John, there's always winners and losers in these kind of things, and that's going to affect how successful it is. Anybody going to be dug in to try to prevent this from happening?
Well, I think that you're triggering the obvious question, which is that this is a market that's been dominated by an oligopoly of DaVita and Fresenius, the two dialysis center providers. And gosh, they run about 70% of the centers in the country, and probably control about 80% of the compensation. And I think that this is going to be a healthy challenge to the dialysis kings, the center kings. And there are some that would argue that the reason that that our home dialysis is less than 20%, and in Hong Kong or Singapore it's closer to 80%, in Europe and New Zealand and Australia it's closing on 50%, is because of this overemphasis on centers. And so I think this is a reform, if we actually get there, which is going to challenge those franchises. What do you think? Who else is a potential loser here?
Well, John, the way I see it is that there's always this talk about draining the swamp, and in general, Trump has done the exact opposite. Here, this is a real example of a terrible thing that's gone on in Washington for a long time, with these two particular companies kind of controlling what happens, spending a lot of our taxpayer money, having a lot of weird dynamics in the private sector. This is how you drain the swamp. I think it's a positive if we can make it happen.
No, I totally agree. And what we have to watch is to make sure we protect that transition to home dialysis. Because even the math on mortality would suggest that when you have to actually optimize a schedule based on what day you get dialyzed, you have a lower or higher risk of mortality, as opposed to doing it at home with your own equipment and evening out and timing that dialysis to protect you. Now, this getting this right will be the definite, will literally lead to people living longer lives or more people dying. I can't think of a more important priority for the government to be paying attention to. And I frankly am a fan of at least what we've heard thus far.
Well, that's it for another edition of CareTalk Shorts. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching. Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.